Welcome, everyone. Thanks so much for joining us in the Office of Violence Prevention for our first webinar today. My name is Kim Caldwell, and I will be your cruise director for our time together. To get things started, we'll talk about how we're going to spend that time together. So we are right now in the welcome and housekeeping portion of this event. We're so glad to see you all here. Following this time, we'll give you the chance to get to know the Office of Violence Prevention a little more. We are a new office, and we have the lead of our Office of Violence Prevention here, Michelle Miles, who will share more information about that. Then we're going to start talking about community violence interruption, and we are very, very lucky to have today a leading national expert in violence interruption. And so we'll take some time to really understand those terms, what those programs look like, what they achieve within communities, and what we can expect here in Austin. And we have saved a good amount of time for questions. And so during that question section, you can raise your hand and we can unmute you and hear from you. But all throughout the conversation, you're welcome to put questions into the Q&A within the Zoom system. You're also welcome to use the chat. So we'll keep our eyes open on the chat and the Q&A. And so without further ado, I'm excited to introduce y'all to the leader of the Office of Violence Prevention and my boss, Michelle Miles. And so Michelle, let me just brag on her for 1 second. So Michelle joined OVP as the manager last June, and she came from the Homeless Strategy Division, where notably she led the Eating Apart Together initiative, which during the times of COVID connected more than 1 million meals to our unhoused neighbors. And that's how I got to know Michelle and really see her leadership in action. She has a Master of Science in Clinical Psychology with an interest in trauma, attachment theory, and mindfulness. So she is exactly the person to be talking to us today. And so, Michelle, I will mute myself and start moving slides.
Thank you, and good afternoon, everyone, and welcome to this webinar as we are introducing Community Violence Interruption programming to Austin. The role of the Office of Violence Prevention is creating the safety for every Austinite to thrive. And we implement a public health approach with an equity lens to understand the assets and struggles and community narratives of our community, which will inform the strategies and investments for our interventions to make hope, peace, prosperity, and health accessible throughout the city. And when we're talking about a public health approach to violence prevention, we're looking at interventions that are further upstream, that are dealing more with investing in community, investing in individuals. We want to have a broad awareness of adverse childhood experiences, also known as ACEs, and how those impact people's resiliency, health issues, but also how it contributes to being a victim of a crime or a victim of harm and trauma, and also a perpetrator of harm and trauma. And so understanding those factors are very important. And then also we are wanting to understand the importance of protective factors and risk factors to increase protective factors while reducing risk factors to harm. And this is the team, myself, Michelle Miles, Kim Caldwell. I will brag on her a little bit. Kim has more than 16 years experience in the social sector. And she worked in homelessness communication for our City of Austin CPIO before joining the Office of Violence Prevention. I worked with her on the Eating Apart Together initiative. She also has previous work experience training more than 1,000 women to run for office. And also she helped to build the No Kid Hungry Center for Best Practices and Consulting, as well as working with nonprofit organizations. She holds a Bachelor's of Science in Public Relations from the University of Texas Austin, Hook'em Horns, and a master's in public service from the Clinton School of Public Service. Our well, I would say not the newest member, because we have a newest member that just started this week, but our second newest member of the team, Henry Agbedy. He joined us on December the 6th of 2021. He has more than 15 years experience in the public health sector. He earned his medical degree from the University of Ilorin in Nigeria and a master's degree in public health from Grand Canyon University, Arizona. In Nigeria and Namibia, Henry served as a public health physician and led initiatives and campaigns to include teen pregnancy reduction, HIV/AIDS stigma eradication, and addressing intimate partner violence. In addition, we have Mr. Quinn Terrius Jones, and he is joining us from formerly working in the homelessness sector. Right before joining the Office of Violence Prevention, he was the assistant IT director at Front Steps, which is our local homelessness shelter. And Quinn has a bachelor's degree in public, I just kind of slipped my mind there, in political science. I knew it was a P. and from Abilene Christian University. He worked in homelessness previously as a case manager, as a payee, running a permanent supportive housing program. He has extensive experience in the field as well. Our newest member of the team is Becky Carter. She's going to do our practicum with us. She has a bachelor's degree in neuroscience and is working on her master's degree in public health and her master's of public affairs at the University of Texas, Austin. And I want you to, this is the team, and I am very grateful and appreciative for them being part of the team. Now for the Office of Violence Prevention, we are taking this safety framework, which we're looking at the different ways in which the different, I'll call them little ecosystems of safety. So you have the safety with yourself, you have safety at home, you have safety in community, and you have safety in society. And as we know with violence cuts across multiple domains. So if you can design an intervention robustly enough, you can target multiple levels of those different domains. So through OVP, we seek to understand how the elements of safety in each of these areas are accessible to residents and what investments and interventions will have a ripple effect across the levels and create new possibilities for safety. In OVP, we're interested in co-creating our investments and our interventions. Yay, we said it on a slide. And first, in order to do that, we need to understand what we're seeking to address. And we want to understand it through community voices, using local data, and through multidisciplinary analysis. You really want to take this very robust, ecological, epidemiological approach to when we are looking to see how are we going to design our interventions using a very data-informed lens. We want to develop evidence-based practices through local lessons learned. There's a lot of national practices that are done, but we want to look at the evidence to tailor whatever intervention we do, whatever practice we do, based on local data so that we can have a meaningful impact for the specific populations and individuals that we want to help. We want to implement, we want to invest in local partners, and we want to evaluate our effectiveness. So through investing in local partners, we are wanting to work with people who are rooted in community, who are close and have a robust understanding of the population and the circumstances that people are dealing with. And we want to evaluate the effectiveness of that programming. And then from those learnings, we would like to scale. We want to invest at the level of need. We want to continue that process improvement piece, because we want to make sure that we are having the desired impact. And so we want to learn as we're going and refine as we're going to make sure and ensure that we are serving the needs of community. And we want to maintain those things that we developed, and we want to operate at the scale that is needed. And then we want to tell the story of our investment. We want to be able to show and tell and share with community the ways in which what we're co-creating is having the desired impact and improving the quality of life for everyone in Austin. And for the fiscal year of 2022 for us, which starts on December the 1st of 2021, we are focusing on creating our structure. We want to build a foundation of the Office of Violence Prevention, and we want to work with the city and with community through research and data analytics and collaborative planning, and through partnerships to do skill building and staff development, because we recognize the importance of investing in community and investing in collaboration, and that we cannot do anything alone. We have to co-create it because we are better together. We want to establish programs. We want to invest in targeted populations and communities through programs that address the interconnected elements of safety and violence prevention. As I said before, we do understand that violence cuts across multiple domains. And so by taking a robust understanding and working with community to find out exactly where violence is happening and how it's manifesting, we can tailor our interventions in that regard, so that we can design interventions that really address what is happening. And then we want to develop our voice. So public health is really a big portion of public health is communications, right? And using that communications to get the word out to community. So a good example of this is with COVID-19. You know, it was a big communications push to inform people about wearing the mask and washing your hands and social distancing. And most all public health interventions has a very robust communications component. So we want to grow our understanding of and support for public health approach to creating safety and influence safety behaviors through public education and communication. Next slide, please. So how did we get here? Austin is kind of essentially a tale of two cities. There's a lot of affluence in Austin, and then there's a portion of population that has not been able to experience the same level of access to prosperity. And so through different things that have happened after George Floyd got murdered, there was a lot of civil unrest and concern about policing and public safety. And in Austin, we had our gun safety task force, our gun violence task force, and our reimagining public safety task force. And through those co-created with community task force and through community calling and championed by Council Member Alter, the Office of Violence Prevention was created. Next slide.
Thanks so much, Michelle. And we will definitely be able to answer more questions about OVP and what we're up to in the question and answer session. But now we're going to move into community violence interruption and introduce our phenomenal guest speaker today. So Dr. Tillman is a national consultant with over a decade of experience in violence prevention, community engagement, reentry, and mental health. He holds a PhD in criminology, law, and justice, with research centered around root causes of violence and mass incarceration. He's a certified practitioner and trainer in conflict management and trauma care. Dr. Tillman has been recognized for developing and implementing violence prevention programs throughout the US and has received the Congressional Veterans Brain Trust Award. So, Dr. Tillman, we're excited to have you with us. Now, I know I just read some bio, but there's got to be something about you that left out that it's important for us to know. Like, are you a Cubs fan or a Sox fan? Is deep dish pizza worth the calories, or do we leave it behind? What do we need to know from you?
Definitely, I was born and raised on the west side of Chicago, so that makes me a Cubs fan. Typically, the people who reside on the south side are Sox fans, but I love Chicago through and through. So if the Cubs don't win, I root for the Sox. In regards to this work, I've been blessed to be on this journey to see the evolution of violence prevention and it becoming a sector where we can complement policing strategies and work with individuals who suffer from the root causes of violence and deal with them prior to them committing the offense that influences or causes law enforcement to get involved where a crime has been committed, where they breached the standard, where a crime has committed. Also, I was fortunate enough to be a part of a small group, the Black and Brown Peace Consortium, or Fund Peace, that actually helped write the Build Back Better, been behind pushing the president to facilitate ARPA funds to different municipalities at the city, state, and county level throughout the United States. And I've been working closely with the DOJ and the CDC, helping them understand how to bridge this gap between different entities within the field of public safety and public health.
Fantastic. And so for those of us who may be new to the term community violence, can you explain what community violence means and how it is different from other types of violence that may be present within an area?
Well, community violence truly encompasses all types of violence within a community or within a small ecosystem. However, the term community violence was created to address it more at the community level as opposed to the individual level. And that's what the term typically means. We're trying to impact an entire community as opposed to thinking of a systematic way to deal with individuals. But in doing so, we use this behavioral science model in order to individualize it once individuals come into this particular program. But the design is to change the normative behavior of a community so that a community thinks about conflict in a different way and tries to resolve it with non-aggression. A great example would be if you wanted to stop one individual from smoking, as opposed to change the climate in the whole office. Like our scope or our desire or our objective and goal would be to change smoking period in the whole office. So we have to use different techniques than helping individuals just on this challenge of smoking.
Got it. So when we define something at the community level, we have community level interventions that make their way to individuals versus an individual level intervention that then gets expanded to community. So it's a different starting place at looking at us in kind of our social systems as humans instead of just individuals. So that takes part of the first two words. So let's talk about interruption and the concept of how violence can be interrupted.
Dr. Sluckin, who is an epidemiologist, came up with this idea of treating violence as a disease, I want to say in the mid to late 90s. And we began to see how violence was a behavior that can become contagious, and it can be. So if we look at it from that particular example, we know that there are certain methods or strategies to not only containing but quelling diseases and solving it. The first thing we want to do is isolate it or isolate the situation. It's the same way we would do COVID, isolate it. Then we deal with the behavior pattern, and then we change the community norm. And that's the way we look at it from a public health approach, so that we leverage all the assets within a particular ecosystem to address the problem together. And one way, I'm glad you brought up the community, the interruption part, is one way we address it is we've evolved from putting the onus on just one organization or institution. We understood that we need other people within the network to utilize their assets to help us combat it, because one organization doesn't have all the components to address all the challenges that an individual may have within a disinvested, vulnerable community, because many times they run deep, far, and wide. So what we would do is deal with the external part, which would be the behavior, but then we would refer them to another agency that addresses the root causes of violence, whether it be mental health, whether it be anger management, whether it be substance use disorder. It could be various variables that cause them to respond the way they do when they enter into a space where there's conflict.
So it's not just interrupting, it's also redirecting.
Yes, ma'am.
Great. And so you talked a little bit about the history of looking at community violence through an epidemiological lens. But can you talk more about the history of these CVI programs and how this public health approach has evolved since 1993?
Yeah, initially it started out with just interruption. We believe that you could detect and interrupt an individual, a particular problem, by having individuals who initially we call credible messengers. Those were individuals with lived experience, knew the community, but also had influence within the community from either their lived experience or some of the work they did. So we believed if we utilize these individuals, they would have information prior to it rising to the level that some physical action typically take place. I love to give examples. A great example was when we was in high school. All the kids would know when a fight would start, but guess what? None of the administration knew. We would know that there's going to be a fight outside after school, and they're going to meet in the playground. It could be in third grade. All the kids knew and whispered, but for some reason, the teacher didn't know till the next day. And it's the same way with violence in communities. Everybody knows when a problem arises between two individuals, and they know the predictive outcome. But in many cases, the people who are the first responders, whether it's law enforcement or other entities, don't find out until after it's already happened. So what we want to do is use this intel with these credible messengers to resolve the issue while there's tension, but nothing has yet happened. So in that same analogy, the credible messenger would be students who hear about the fight and intervene prior to them going outside and actually having this physical confrontation.
And so I know that different programs have popped up in different parts of the country. And so can you talk a little bit more about your experience and what you've seen as these things have expanded? What has been exciting to see grow?
To be honest, what's been exciting is this ecological system, or this comprehensive model that includes this notion of violence being a public health crisis, but has evolved to understanding that once you deal with this particular issue, the individual needs so much more. And one of the things they need is sociogenic properties, which is they need some stock, whether it's a job, they need whether getting married. They need some hope, something to live for, so that they don't go from baseline to outbursts over every little situation. So what we do with these organizations, we have a case management system to find out what they need help in and try to, if we don't directly render those services, connect them with one of our partners to help them provide them particular services. So that's what I'm really excited about, the comprehensive models, because it allows people who have always been doing work, small CBOs, which is community-based organizations, now to get involved in whatever their slice of the pie, they find their way into this larger ecosystem and able to work with larger agencies to help remove these stereotypical thoughts in the community, but also the behaviors. Because it's not just the perspective, we want to remove the behaviors as well. But now the people who have always been doing great work have support, and what we're doing, we're providing technical assistance to train them, because a lot of smaller CBOs never collected data. So we show them simplified, easy ways to collect the data to be able to better tell the story and narrative of the work they're doing.
Great. And I do want to real quick, CBO means community-based organization.
Yes, ma'am.
So that might be what we refer to as an agency or a nonprofit.
Yes, ma'am.
Great. And so what it sounds like you're saying is, if we want safety at the scale of community, we engage resources at the scale of community.
Yes, ma'am.
Awesome. And so you've talked a lot about kind of the process of getting in and understanding what's going on, incredible messengers. What has come from, what have been some of the types of outcomes that have come from CVI work being launched within communities?
The best example would probably be New York. How New York was one of the most violent cities in the 90s. Now it's the safest, largest city in the United States. New York, even though it has a population close to 10 million, has around 200 homicides. You say, well, still, that's bad, Chico. But if you compare New York with a population of 10 million and 200 homicides to Chicago that has 2 million people and 800 homicides, you can see how great the CVI is working. And also in the early 90s, New York had over 1,000 homicides. So they went all the way from 1,000 homicides to now around 200, with close to 10 million people, around 7 to 8 million people in different boroughs and the surrounding areas. So and they have a comprehensive, they have something called CMS, which is a crisis management system, which uses a public health approach, but has a comprehensive strategy that includes those other components that we're going to utilize here.
So that is kind of not only interrupting and redirecting, but then really case managing that redirection so that folks have what they need to continue on that path. That's awesome. And so are there any kind of more kind of breaking down some of the metrics along the way? Like as a program's being introduced, what types of changes do you see on the way to that large reduction in violence?
That's a great, how do I make sense of this and say, hey, it's not Michelle and her crew doing it, it's a work of God, or it's the police. So what we do is we collect both quantitative and qualitative information or data. So we will have all of the mediations or interruptions spaces we've been in throughout the entire year. We'll have case management that talks about all the individuals that's at the highest risk that we referred to other agencies. And we have all the contact of quantitative data of all the individuals that had come into the program through different entry points. So we will have data of all the lives we've touched and the impact it had. And lastly, we'll have narratives.
Yeah.
Narratives with the case management of this situation happened, it was pretty bad, but we resolved it. So there'll be different, you can go through case after case of some of the things that we were able to interrupt, to know that we played an impactful part in the violence decline.
And so I did have a question from Tara Tucker, who wanted to know. She said police take credit for New York crime drop, and some police groups claim that it was stop and frisk. So how would you respond to those claims?
Well, according to data nationally, we know that the carceral approach failed miserably, because what it did is it caused an explosion of mass incarceration for Black and brown people. But violence in the 90s was what? At an all-time high. So stop and frisk, 3 strikes, all of those things failed miserably. What happened is, and I would say this is what's happening in New York today, a relationship has developed between CVI and policing where, in unique, they understand the value of CVI and allow them to deal with situations. And in many cases, because I do a lot of work in New York, the police will see individuals from the CVI program, CMS, handling a situation and will leave. If they say, we got it, you know, we're going to calm it down, the police will leave. And if it's escalated to a point where hypothetically an individual has a gun, he's irate, then they'll let the police take over. But this relationship grew over time. So it's not just the police. As a matter of fact, the president was in New York maybe 3-4 days ago, and he highlighted CVI along with the police and said he's going to double down on his investment in CVI, because even the police and the mayor, who's a former police officer, acknowledged that the great decline in New York is because of CVI. So the mayor, who has a background in law enforcement, has openly said that CVI is the cause for this great decline, because not saying police officers don't do great work, but their job is responsive in nature. You don't call the police until a crime somebody's already been shot. You don't wake up and say, hey, 2 guys got into the argument. Could you watch them today? Or I think something might happen. Police aren't going to respond like that. Police respond after something has already happened. So with them being responsive in nature, it would be hard for them to prevent a lot of things, except when there's a police presence. But we know that they don't have the capacity to be everywhere all at the same time. So that's where CVI comes in, not just with physical presence, but with this framework to change the mindsets of people in these vulnerable communities.
And so that segues into my last question before we take things local, which is, when you're looking at a quality CVI program that's gonna produce the kinds of results that you've shared, what's really critical? Whether it's alignment or specific elements, like what do you have to do to really make CVI something that reaches its potential within a community?
The most important thing is the staffing and the community buy-in. Because if you got the right staff and the community buy-in, then the community is going to reach out to you when something is about to happen, and at least give you the opportunity to deal with individuals on both sides of the situation. So the community buy-in and having staff that understand their role and are in the trenches, having this sixth sense about when things are about to happen, but also constantly building relationships, not just with individuals at the highest risk, but residents too. And allowing them to know the beauty of CVI and why it's so powerful is because a parent feels comfortable calling someone that's a credible messenger and say, hey, my son is doing XYZ. I think he's thinking about getting a gun. Because she know by telling somebody from CVI, it's a high probability if they come talk to him, he's gonna come home. If you call the police and say, hey, I don't know, my son is having a rough day. He talked, him and a guy had an argument. He talking about getting a gun. It's a probability somebody at the very least is gonna get arrested and going to jail. So if you think about it from those pretense, then you'll see why CVI has been so powerful. And plus, these are people that know everybody in the community. that have strong community buy-in, that have the relationships already. And also we're going to do community events to help galvanize and empower the community. So it's multiple things that's going to happen to strengthen the community and get this buy-in. But the key is the staff. You could tweak some of the model to make it adaptable to the community, because communities' challenge vary, but you need the right people. You need the right people who have those relationships.
And so just to help folks on the call who may not be as familiar with the model yet, when we're talking about those interrupters, the staff within the community, how do those compare to like a community health worker? Is it kind of the same idea, different curriculum? Like how would you compare those two?
I think you would get individuals with lived experience from the community with influence. Typically, a lot of them are justice impact or have some of the same challenges that are within that community. If it's in a community where we're dealing hypothetically, just say with a lot of individuals that's undocumented, you will want an individual with cultural competency and cultural sensitivity and humility that understand what these people are going through and have a relationship with them, whether they have relatives that are in this population or whether they went through this process themselves. Because then the person that's talking to them will feel more comfortable talking to them about where they're at in the situation and help them resolve it. As opposed to an outsider, they could be an individual from Austin, the same ethnicity, but haven't had the same experiences. They won't be able to understand it through the lens in which the person is giving them this information. That's what a credible messenger looks like, and that's why it's critical.
Got it. So, so switching now to specifically in Austin, Dr. Tillman, I know you've had a chance to get to know us, and as delightful as we on the OVP team are, I don't mean us, just us. I mean, also you've had some chance to do some work, reach out to folks. And so I'd love to hear, and I have a little visual here. So what have you learned about violence in Austin, where it is, how it is spreading, and how, so I will stop asking this question in such a long way and just ask, what do you know about us so far? Tell us about us.
The thing that, when I think about Austin, it's two major challenges that I've seen that played a role in the spike in violence over the course of the last 5 to 6 years. One would be, of course, the housing spike, the huge surge, the housing movement, which the taxes exploded and caused a lot of individuals to lose their home and caused large encampment areas, which literally broke my heart to see. But also this large population in the North, that's this undocumented area where they say the reports referred to it as sex trafficking, but really it's individuals participating more so in sex workers because they don't have an outlet or entry point into mainstream society and a way to make a living. So those two key things first stood out to me. And that's why this work is so important, because even with the latter situation with this undocumented population, we would have to bring in individuals, more so someone with a background in clinical services to help these young ladies or deal with some of the challenges that they're enduring in order to have access to equitable living. So we got to look at, and it's deeper than just hiring individuals at an outreach level who don't have that understanding. Whereas a little bit to the south, it's a different look where it's more about disinvestment and a historical disinvestment. So we would think about what services they would need in order to help them deal with some of the challenges they do. But also we want to give them protective factors and give them skill sets to have immediate impact, and help them think about dealing with the conflict or challenges in a non-aggressive way. Because to deal with the root causes, one is longitudinal, getting them service, but the immediate thing we want to provide is a skill set to put in their toolkit to allow them to resolve conflict without aggression. So we're going to do that, but also we're going to talk about, hey, we understand this long-term problem exists. We want to help you deal with this too. And that's the way we see it.
And so as right, we have put up on the screen a map that shows, I believe from 2020, where there were major issues with firearms. I think, those of us, I don't know if y'all are like me, where the first thing I do is I find where I live on the map and look at it and think, okay, where do I compare to things? And then also, these are some of the areas that you recognize within your report we have on the screen as well. And so I think one of the things that you've already spoken to is how, these are different areas with different issues, right? And that are going to need different support. So as we're looking at what gets created in Austin, Dr. Tillman, you just spoke to that, but Michelle, I'd love to hear, as you're thinking about the programming that we have been, that council has said and designated funds for Austin to bring CVI through the Office of Violence Prevention. What are you thinking about? What's going to be really critical to the success of that program?
So what's really critical to that success is, in fact, launching CVI programming in Austin. And right now I have allocated $800,000 to target 2 of the hotspots to provide that service to the community. And as Dr. Tillman mentioned, we would like to do a request for proposals from the community. And we are looking for organizations that can work and utilize trusted messengers that is specific to a certain location and speaks to the needs of the location to be able to provide services to the community. We want to identify and disrupt potential violent conflict, prevent retaliations, work to mediate ongoing conflicts, and also work to keep things cool in community. And then we want to provide the services to the people that are at the highest risk. So we want to assess for risk, encourage change behavior, and provide case management, access to resources, which is really important because OVP is not only going to work to implement the CVI, but we're looking to implement and coordinate other resources in community so that people have access to increase the protective factors, because that's really important. People need the supports so that they can be able to get their needs met. And it's really hard to get your needs met when you're just focusing on survival and you're constantly under stress. And then we also want to work through that work to change the community norms. You want to respond to every shooting. We want to organize community, and we want to work to change the norm so that violence is not something that we're accepting of, that we're intolerable of violence, that as a community, nope, not here, we're not going to do that type of stuff. So it's really important for us to get that community buy-in, but we also have to show that we care because we want to be thoughtful in what we're providing that is being informed by community and by data, and that is designed to have a impact, because the goal is impact. So we want to be held very accountable for that as well. And there's other things that we're wanting to do, like our community rooted admitting grants, which is focused on providing smaller grants to community rooted organizations to deal with safety and well-being, such as crisis intervention and victim services, emergency funds, healing and repair from harm. And those are things like transformative justice circles and restorative justice circles, as well as some economic empowerment activities. So I could go on and on. Because there's a lot more. But those are some of the things that we're focusing on right now. And the CVI and the community-rooted grants, those requests for proposals should be coming out soon towards the beginning of March.
Thanks. Thank you. And so, Dr. Tillman, to put you back on the spot, since you've already talked about what a good friend you are to the White House, Austin was designated as one of the cities, as one of the CVI collaborative cities. And so I'm interested to know, and I think folks on the call may be interested to know what that means and what additional support or opportunities that might be bringing to our community.
I am on the spot. I'm working with my colleague and friend, Anthony Smith, who is one of the 4 organizations. He works for Cities United, and Cities United, one of the cities that was assigned to them is Austin. We've talked extensively about how we can support Austin. One of the things that's going to be provided to Austin is additional technical assistance, some financial support, but more importantly, Austin will be, it's an advantage. I'm just be candid. It's an advantage because now the president has doubled down on these 16 cities with $10 billion in DOJ, another $200 million in the budget for CVI. The probability of Austin getting additional funding is exceptionally good because it's one of the cities that the president has highlighted. It's one of the cities that he wants supported. And I truly believe those 16 cities won't fail because of lack of resources or opportunity. It will only be if we don't put the effort in to make things happen. Because it's more money this year in violence prevention than all the years prior combined. Mm-hmm. That's how much money. And with Build Back Better coming eventually, it'll be another $600 million over 8 years, $680 million a year for 8 years, so that we'll have not only sustainability. What we wanted to do when we were writing this is the ability not only to sustain but to scale. And I've talked to Michelle and her team, and I know there's a desire not just to be in 2 or 3 communities, but to offer these services throughout Austin. So that's the great news, that the vision is about scale and about helping everyone that's a resident and citizen of Austin. And we wanted to start in the most difficult communities to get it right before we scale out to the rest. But there will be opportunities for us to scale in the near future.
Thank you. And so we have about 9 minutes left for questions. And so if anyone would like to ask a question out loud, you can raise your hand and I will call on you. We had a question chatted in. So you spoke to this a little bit. The first question was curious to hear specific stories or examples, particularly if redirection can mean providing youth-centered programs. And so I will just say quickly, Michelle didn't mention that we do already have, as OVP, 3 programs that we're supporting in the community. And I know many of those folks are on the call today with Carrie, YWCA, and Mexicarte. But now that question about how redirection can work with existing youth programs.
Are you asking me that?
So are you asking?
I mean, this is that moment of yes. So my understanding is that yes, these things do intersect. And when you talked about, bringing all the community resources to bear and really having those interrupters be able to direct folks to the places that are going to meet their needs in an immediate and meaningful way. I guess
I like to answer some. So, I think youth programming is crucial, right? I mean, if we're looking upstream and we're looking to support families and community and support youth. I mean, if you think about what youth are going through, youth are afraid, in a lot of these communities that are divested in. And so as policymakers, as adults, it is our responsibility to invest in our youth and our children so that they feel safe and secure in their communities. And so by showing that investment and that care to provide that safety and to help build those protective factors for the youth is really important. Right. So it's just one of the tools and the protective factors in this, through taking this kind of social ecological approach to addressing violence, is that there's multiple levels and multiple areas and multiple populations that we're trying to really infuse resources and to create stability. If you think about Maslow's hierarchy of needs, for a lot of people, if you're just focusing on your basic safety, your food, water, shelter, safety, security, if that's your basic focus, then how can you focus on anything else? And anything that's piled on top of that, if you don't have those other levels being addressed, it's going to be a crisis for you. So we have to really protect our children, and we really have to invest and also weave that into the entire ecosystem of our safety and well-being.
Thank you, Michelle. So that, I think, right, the shorthand that sometimes we say is invest, not arrest. Mm-hmm. And that's just what happens when we decide that rhyming is important. So Nicole Golden has her hand raised. And Nicole, I just clicked allow to talk. So if you unmute.
Yeah. Hi, can you hear me?
Hi, yes. Nicole.
Hi there. Thank you guys so much. This is wonderful. And I knew it would be. My quick question, I hope it's quick, is that, so I'm the interim executive director of Texas Gun Sense, a statewide gun violence prevention group, and there may be probably other advocates on here who represent other advocacy groups. And I really want to know, this is a priority area for our organization, not only in Austin, but statewide. And so I want to know how groups like ours that focus specifically on one side of the issue with regard to firearm safety and prevention can support community violence intervention programming here.
Thank you.
Well, I think there's many ways that you can support. I mean, even with our current contract in the Office of Violence Prevention, we contract with Lock Arms for Life to provide safe gun storage, education and informational materials, as well as gun locks to secure firearms, right? So we recognize that there is a need and there's importance to educate the community about safe gun storage and to provide the actual gun locks so that those locks can be, so those guns can be safely secured. We're not anti-gun, we're about securely, securing firearms and safe usage of firearms. And so when it comes to pulling together community and the various groups within community to work together to design the ecosystem and the co-creation of what does a violence-free Austin look like, organizations such as Texas Gun Sense and Lock Arms for Life are really important to be pulled into the conversation because it's all interrelated, interconnected.
Thanks, Michelle. The next question, and thank you, Nicole. The next question from Tabitha is, will hospital-based intervention programs be implemented?
Now, in Austin, we're looking into that. We're looking at the data right now. The Office of Violence Prevention has been in operation since June the 7th when I got hired, which is about 8 months ago. And we're still collecting data on where violence is happening in Austin. And so through the work of Dr. Tillman, through the work of the National Institute of Criminal Justice Reform, we're working with APD to look at the crime data, to talk to officers, to see where exactly violence is happening. and hospital-based interventions. If it's seen that we need it, we will be investigating that. But we're also thinking about some other hospital-based interventions when it comes to addressing, providing safe, gun locks for, like say, for example, if a mom comes in and has a baby's opportunity to talk about, gun safety and things like that. But in the strictest sense of what you're asking, we're going to look to the data to see if that's needed in Austin.
Thanks, Michelle. The next question, and we have about 2 minutes left. So the next question was how closely OVP, Lynn wanted to know how closely we've been working with local schools, public and charter.
Right now we have, I think Kim mentioned this before, we have contracts with CARI, the Council on At-Risk Youth, and YWCA to put school-based programming in targeted communities that have been divested in or have experienced high degrees of crime or violence. And so we started that work there. Actually, today after this meeting, we have a meeting with Navarro High School to talk to them about community violence work. And so we're right now, as we're building out, the goal is to partner with the local AISDs of charter schools to address violence at that level as well, and to pull them into the conversation because it's part of the ecosystem.
So I think we have time for one last question, which I love this question. How can local organizations new to this initiative provide support and resources? And Belinda, for asking that, I owe you about 17 high fives. So how can local organizations be part of this?
So kind of one of the reasons why we wanted to have this webinar was to expose the Austin community to CVI work. As we're doing this work to get the word out around community violence interventions or other violence prevention strategies, we want to educate community so that when we're putting out, for part of it is for me, it's like when we're putting out funding or we're aware of other funding coming available, we want the community to know what's available. Because we want to pull community in, and we want to resource community. And we also want community and community organizations to share the word. And we also want to pull everyone together so that we can start working together to figure out what's needed, how to direct resources, and how we can help each other really change the societal norms around violence, but also to really resource community so that we're looking for long-term sustainability, so that we can create literally a place where violence is greatly reduced and hopefully a thing of the past, right? And if it happens, that we have the resources to support people so that they can achieve the level of happiness that they would like to achieve.
And so I know that there's another question from Alicia about CVI and how that connects to the reimagining public safety hubs. And I would just say, think about CVI as one element of what's invested within a community. And so it's not the whole thing, but it's part of what gets that community access to expertise and resources. So we are at time. I want to say thank you to everyone who joined today and who asked questions. I want to say thank you to Dr. Tillman for his time and all the support that he has been putting into our work. I want to say thank you to Michelle and to the rest of the OVP team. This was our first go at one of these. Like you said, our office started in June of last year. So we're having a lot of firsts. And our plan is to upload this video onto our website, austintexas.gov/OVP. If you haven't been there, I mean, I'm partial to it. It's a pretty great website, if you ask me. And we want to use that as a hub to keep folks engaged and informed on what it is we're up to. And right, the goal is that it is our work. And so we will be also launching in the near future a really interesting campaign called Address Your Stress. We're going to have that launch by the end of the month. And so that's your little special teaser for sticking with us to the end. And so that'll involve a public education and community awareness campaign. So get excited to learn more about the body stress response and how we can work with it to keep stress from hijacking our lives and causing unnecessary violence. So thank you again, Dr. Tillman. Thank you all so much for being a part of this. And we look forward to more opportunities to work together for an Austin where everyone has access to safety. Thank you.
Thank you, everyone. Bye.